It's summer in Europe, and people are spending a lot of time outdoors. Few are worried about getting COVID now. Almost all of the health restrictions and safeguards have been lifted. But in many places, cases are on the rise again. What stage are we at in the pandemic? That's the question we'll be asking in this edition of our COVID-19 special. The head of the World Health Organization certainly sounds concerned.
With continuing transmission, decreasing testing and sequencing, and 40% of the world's population still unvaccinated, the pandemic is not over. It's vital that all countries continue to vaccinate, especially those most at risk, including health workers and people aged over 60.
We begin with a look at new coronavirus studies on long COVID, and we'll meet a Mexican researcher who's working on a new treatment for COVID-19. But first to Germany. Very few restrictions remain here in everyday life. Politicians are debating the possible introduction of safety measures for the coming fall in case the country is hit by another wave of infections. What do people on the street think? We canvassed opinion in Berlin.
In the evenings, when it's cooler and the sky is still light, people spill out onto Berlin's streets and into the parks. On the longest day of the year, the Fête de la Musique always offers free outdoor concerts. This year, the events took place without any restrictions for the first time since the start of the pandemic. No proof of vaccination or a negative COVID test was required. There wasn't a mask in sight and no way to socially distance. Many have simply had enough of precautions. They want to party together again and leave the pandemic behind them.
It's wonderful. It's just real life.
Though not everyone is so completely carefree.
It does feel a bit strange, but it's okay outside. When I go indoors, I do wear a mask. And that's still important on public transport. But it's nice to be able to be here outdoors without a mask again.
But despite the nice summer weather, the number of COVID cases is rising in Berlin as elsewhere. The 7-day incidence now stands at over 430 per 100,000 people. And the actual number is likely to be far higher, as few people are getting tested now. Sibylle Katzenstein is a GP in Berlin who's been treating COVID-19 patients ever since the pandemic began. In recent weeks, she's been seeing more young people.
Many find it scary that their performance is impaired for many weeks, that they feel pressure in their chest. So self-protection is still important. You can't prevent it completely. If you get it, you get it. But it's not as if Omicron doesn't cause an unpleasant and often quite protracted illness.
Each day, between 300 and 500 people come to this test center in central Berlin. Its operator says on average, 20% of them are testing positive. Till now, the rapid antigen tests were performed for free, but as of July, most people will have to pay for them.
In poorer districts, it's extremely hard for people to pay 20 euros or something for a test, which means that, once again, things will split into those who have money and can get tested, and those in more disadvantaged areas who will be left behind and catch COVID more often.
To prepare for the expected rise in infections, the German government plans to enact new measures before Parliament's summer break. 2 years ago, Berlin's first COVID-19 patient was discovered in the Mitte district almost by chance. Ever since, the head of its health authority has fought for better equipment and more personnel. Yet in September, the contracts of most support staff are set to expire.
Who knows what kind of variant is coming? We'll try once again to reach out to people who don't have a GP to vaccinate and advise them. It's high time to start planning things.
The current Omicron variant has even caused staff here to take a more relaxed approach. Still, Dr. Lucas Moraida cautions that anyone who feels ill should stay home.
Vulnerable groups should get vaccinated, Wear masks in enclosed spaces that can't be aired out. Otherwise, have fun.
And having fun is certainly what Berliners are doing. Ole!
And what does the situation look like in South Africa? The highly infectious Omicron variant was discovered here 6 months ago. It's now winter, and yet the situation seems very relaxed.
As South Africa is exiting its fifth COVID wave and restrictions have largely been lifted, normality is returning to downtown Johannesburg.
Yes. That's the one. Yeah, man, the worst is past. The sun is shining. We're taking some pictures. It's a good day, man. I'm happy that COVID is over now and things are coming back to normal.
Only a few months ago, the first global epicenter of the Omicron variant was right here. This area of the Steve Biko Academic Hospital became the immediate response center for the spike in hospitalizations at the beginning of the country's fourth wave late last year. Dr. Farid Abdullah runs the hospital's COVID-19 ward. His team published the first paper on the severity of Omicron.
With Omicron in our fourth wave, we saw a decoupling of the cases and the deaths. And, although there were lots of cases, we had fewer hospital admissions, less severity of disease. And then with our fifth wave, with the BA4 and 5 variants, we had even a continuation of that trend.
Most of the response wards at the hospital are being decommissioned. Abdullah believes the milder fifth wave is a result of immunity built from prior infection or vaccination, or both, which provides enough protection against Omicron and other SARS-CoV-2 variants. A survey of blood donors has indicated that about 98% of South Africa's population has likely been exposed to the virus in some form. Though the disease could be becoming endemic, Dr. Abdullah says managing its spread is still important.
Testing has completely collapsed in South Africa. Most people don't test if they have suspected COVID. It's only those people who are severely ill come to a hospital who get tested. So we can't really measure our cases by testing.
Interpreting trends in this new phase and determining the appropriate public health response requires alternative COVID-19 indicators. And that's the aim of the South African Medical Research Council's wastewater surveillance program.
We visit the wastewater plants every Monday. We will collect up to 9 samples, and we use it to detect dead RNA in order to get an idea of the spread of COVID-19 in a community.
The lab receives the samples, analyzes them, and reports results on this dashboard. These electronic maps depict RNA trends for over 80 sites in some of the country's most populous districts. At another laboratory, genome sequencing surveillance continues. Though immunity to the highly mutated, highly transmissible Omicron variant is likely to grow among the population, scientists advise caution.
There's always a possibility for a new variant. We don't always know what drives it, but it seems to be mutations in immune-suppressed patients, also just herd immunity, but it's also possible that there may be animal reservoirs that drive additional mutations occurring.
Researchers agree vaccination is the best line of defense. Vaccination drives like this one aim to raise awareness and improve take-up. Curtailing the spread of the virus is harder in the cramped living conditions of many South African townships.
It was very hard because we were so scared. What if somebody get infected? So how are we going to keep those social distance? Because now it's a small house. Yes.
But despite increased access to vaccines and boosters, the country's vaccination rate stands at just 31%.
In this community where we work, we see that people have not been actively taking the vaccine because, first of all, they don't see the numbers as they saw in the first wave. They're worried about the side effects of those vaccines, and they observe those who have taken them. And the last one is because they don't trust the government messaging.
Different contexts affect how COVID develops. While South Africa appears to have got off lightly in the fifth wave, the same might not be the case for other countries.
Do you have any questions on COVID-19? Our science correspondent Derek Williams has the answers based on the latest research and analysis. Send an email to covidproducer@dw.com. This week's question is from Ian Sush. He asks, how soon can we expect vaccines that target the Omicron variant?
From the early days of the pandemic, experts have talked a lot about a big strength of messenger RNA vaccines, which is that it's easy to tweak them to respond to fast-changing pathogens. When the highly mutated Omicron variant hit the scene in late 2021, it seemed like it was time for them to really finally start fulfilling that promise. Manufacturers announced that they could adjust and shift vaccine production by March. But that promised delivery date passed months ago, and we're still waiting for Omicron-specific boosters. So what's taking so long? Well, it's complicated, and the experts that I read say that there are several issues, but really the central one seems to be that clinical trials with Omicron-specific mRNA vaccines so far have returned kind of a mixed bag of results. Omicron-specific vaccines did do better against Omicron than older ones did, but not really significantly better. And if they're not significantly better, then it'll be a lot harder to convince people that they need an Omicron booster. And if people aren't convinced that they really need them, then they just won't get them, which of course lowers a pharmaceutical company's incentive to produce them. Moderna now wants to provide what's called a bivalent booster this fall, which is a mix of its old vaccine against the original virus and a new Omicron-specific one. Pfizer and BioNTech also just announced results with an Omicron update vaccine that look quite positive, but healthcare authorities are still looking at all that data. This issue really boils down to how healthcare authorities define the goals of vaccination. Are they to prevent infection completely, but maybe only for a short time? Or are they to build up more long-term protection, but only against serious disease or hospitalization or death? Because so far at least, existing vaccines appear to still be doing that quite well against Omicron too. Greenlighting an Omicron-specific vaccine that just incrementally improves on that is not going to be enough to set off new mass vaccination drives, especially when most experts expect SARS-CoV-2 to continue to mutate. And we have no idea what possibly vaccine-resistant variants might pop up next. So, long and short, Omicron-specific vaccines could be available by September or so, at least in bivalent booster form. But ultimately, now it looks like there'll only be one piece in the coronavirus vaccine puzzle.
To respond to the changing course of the pandemic, researchers worldwide are not only working on COVID vaccines, they're also developing new medications to help reduce the severity of infections and minimize the symptoms. The efficacy of these drugs against new variants needs to be tested continually. We went to Mexico to meet a scientist who's working on a new treatment and has some hurdles to overcome in the process.
While many of us were confined to our homes during the pandemic, Paula Castillo was also locked up in this laboratory. The microbiologist is developing a biopharmaceutical that's designed to stop SARS-CoV-2 from entering the cells and multiplying in the body. It focuses on sequences of the virus which have so far remained unchanged, meaning it should work for any variant.
We're in the process of testing the drug on all the variants that have emerged so far. We're expecting it to show 90% effectiveness against all the variants.
That would mean that in 90% of cases, the drug prevents SARS-CoV-2 from replicating in human cells. But this still needs to be tested on animals and later in clinical trials. Developing new drugs is a lengthy and expensive process, and one of the biggest obstacles for Paula Castillo's work is finding the funds, because Mexico's government has cut the budget for science and research.
When it comes to developing research projects, getting financing in Mexico is difficult. The public funding that we get for our institute's projects is generally very limited.
Young female scientists like Castillo have a particularly hard time in Mexico's male-dominated science community. The researcher was even urged to abandon her career after becoming pregnant, but she refused to give up. The biopharmaceutical she's developed has already passed the first phase and is due to undergo animal testing soon. But new COVID variants are slowing her down because she has to test her drug against each one, on top of already dealing with a slashed budget.
If I want to do 50 trials, I need to remember my budget and restrict myself to what was planned at the start. Originally, I expected to be done in a year. Now we're up to 3 years because there's not enough money for what we need.
In 2 months, she hopes to publish interim results. However, one epidemiologist at UNAM, the largest university in Latin America, has expressed doubts about the real potential of this biopharmaceutical. He points to the lack of reported evidence and the haste of the Polytechnic Institute in publicizing its findings.
Only clinical trials, which have to be published, can show whether or not a product is genuinely effective. But here they assume in advance that it must be effective because they're so convinced by its molecular structure.
But despite the doubts and lack of funding, it could ultimately be the need for effective ways to combat COVID-19 that gives a boost to Paula Castillo's work.
And now, Science Update. The COVID studies making the news. This week, long COVID risks after vaccination and how stress impacts mortality.
Some scientific studies have titles that are really hard to decipher. But this one is pretty self-explanatory. You know straight away that it's about long COVID and whether it can affect anyone, even someone who's vaccinated. One of the most important takeaways is that the researchers found that vaccination does lower your chances of getting long COVID if you end up catching the disease despite being vaccinated, a breakthrough infection. It also lowers your risk of dying from the disease. Here's a breakdown of some of their results. First, how probable is it that someone with a breakthrough infection will end up later with long COVID symptoms? To answer that question, the scientists compared a group of 33,000 breakthrough patients with a range of different control groups. In total, data from around 13 million patients flowed into the study, so it was quite a large one. One of the authors interpreted the article's long COVID results in a Twitter thread. Compared to unvaccinated people who got COVID-19, he said, vaccinated people with breakthrough infections were 34% less likely to die and 15% less likely to develop long COVID symptoms. So, in summary, the study helps clarify an issue that's long been under debate. It indicates that although vaccination does indeed lower the risk of developing long COVID, it does so less than experts had hoped. It's not a silver bullet against the condition. Stress is bad for you. Everyone knows that, right? The authors of this new study, however, are a lot more specific. They say they've shown it's bad for the immune system and can cause diseases like COVID-19 to be more severe and potentially deadly. The researchers looked at the distribution of immune system cells called leukocytes and how they change in situations of acute stress, and how that process is tailored and guided by distinct regions in the brain. Also known as white blood cells, leukocytes help defend the body against pathogens like SARS-CoV-2. By the way, the study has so far been published under what's known as accelerated article preview, so it hasn't yet completed the full editing process. And another caveat, the study was also in mice. That's important to know because it means we can't be certain the same things happen in the same ways in humans. Even so, though, the results are interesting. They reveal that levels of certain white blood cells fell when the animals were exposed to acute stress, exactly the cells that are able to recognize and neutralize specific pathogens. Then the researchers exposed the mice to the SARS-CoV-2 virus, and they observed that, compared to the relaxed peers in a control group, the stressed-out animals had higher viral loads and died at higher rates from the disease. In other words, in mice at least, stress seems to play a role in both COVID-19 severity and progression.
Despite progress made in the field of COVID research, the virus has resulted in large numbers of deaths worldwide. So far, the virus has claimed over 6 million lives. In London, those who have lost friends and relatives have organized a memorial site, a place to commemorate those who lost their fight against the virus.
One quiet act of love, a collective cry of grief and anger. Each heart marking a life in the UK lost to COVID-19, inscribed by friends and loved ones left behind.
The first heart I painted was this one here, which has got Steve's name in. So Steve was my partner for a long time and my husband for 3 weeks.
Fran Hall is among a group of bereaved volunteers who helped create and preserve London's COVID memorial wall. It's now grown to over 150,000 hearts, spanning a staggering 500 metres.
It's just flabbergasting seeing this wall now and how far it goes. It just puts it into perspective.
It allows me to remember my partner and make sure that he's always remembered.
We'll never forget these people, and obviously no one has. So I really appreciate seeing this.
But behind this official-looking memorial lies a remarkable story. It's a renegade project created without permission. And on the day the first hearts were painted, Fran was risking not only a fine, but jail.
I've never broken the law knowingly in my life, so there was a feeling of like, oh my goodness, I hope I don't get arrested. But actually at the same time there was a feeling like, I actually don't care. I don't care. The worst thing in the world has happened to me, and I don't care about anything like that anymore.
Behind the scenes, they were being advised by the anti-government activist group known as Led by Donkeys, who helped set them up with signs and sandwich boards to appear as official as possible. Over a year later, the wall still stands, but it's not without its controversy. Deliberately set opposite Parliament, it's making a political statement, seeking to criticise the government's handling of the pandemic. But should a memorial, which aims to represent all, promote the political opinions of some?
I think the beauty of the wall is that it can be whatever you want it to be. If you just want the wall as a place of remembrance, then that is what the wall can be used for. If actually you feel angry at the government, putting a heart on the wall is almost an act of protest, but it doesn't have to be all those things.
The government says it's planning to establish an official commemoration. But to creators like Tom, the grassroots origins of this memorial are at the heart of its power.
We felt really strongly it was right that this act of memorialisation was not in the hands of the government. This wall is a people's wall, and it's a wall for the people who lost loved ones. That, I think, is the beauty of it. It's been installed by thousands of people over many weeks, and it's still living and breathing now, if you like.
For Fran, every heart she paints is an act of love. For her husband Steve and the many others who were lost.
It's a wall of absolute trauma and grief and loss and fury and rage and confusion. How has this happened in our country that this many people have gone? They're all dead. They're all dead. And this symbolises that loss in such a powerful way.
In the years to come, it may be hard to memorialise the loss and the pain wrought by COVID. Countless commemorations in countless countries for countless dead will seek to try. And this wall, made by those who can tell the story of the pandemic best, could be a model as we all attempt to process our collective grief.
That's it for today. Next week, we head to Portugal, where the new Omicron subvariant BA.5 saw COVID infections soar despite the warm summer temperatures. Scientists are still researching the variant, which also pushed up Portugal's overall death rate. We'll see you next week. Until then, stay healthy.